My mom's a nephrologist, my dad's a cardiologist, and they used to take me when I was a kid to the hospital, and I just always felt comfortable there. And I ended up following the footsteps of my dad and being a cardiologist. So my parents are my role models, and not only are they great people, but they're great doctors, caring doctors, so I just try to model myself after them. That first visit, I'm trying to establish a rapport with the patient and their family, and I'm also trying very hard to put myself in their shoes and empathize as much as I can. Oftentimes they've seen 4 doctors, they're frustrated, they're scared, and the goal is just to try to make them as comfortable as possible and get the diagnosis and really try to come up with the best treatment plan. And my patients are my heroes. You know, they fight battles every day that I couldn't even imagine fighting. You know, getting to know them and their families and doing everything I can to make their life better, that's the best part of my job. I mean, one of my interests is in a disease called amyloidosis, which is a disease where abnormal proteins deposit in tissues and organs and cause dysfunction. And one of those organs affects the heart, and that's where I come in. This is a disease that notoriously had a very bad prognosis. Before, we didn't have much to offer, and now there is all sorts of clinical trials and new medications, things we can do that we couldn't do in the past. So it's an exciting time. I've seen well over 250 patients just because we've become a referral center, and we're also better at diagnosing it. And every year I learn more, and every year I learn that there's more that I don't know. You become more humble with every year as a physician. So I'm learning more and more about amyloidosis, and I hope 10, 15 years from now we are doing even better. I have 2 nieces and a nephew, and to me, nothing really tops an afternoon with them. I can't really think of anything else that's more fun or more meaningful to me than spending time with them.